Thanks very much, Steve.
It's Steve.
Oh, it's Steve. Okay, got it. Pleasure to be here. Thank you. I'm Ted Mlynar, partner at Hogan Lovells, and yes, I am a blockchain attorney, a blockchain evangelist, and I'm here to share with you the excitement of blockchain as it applies to the healthcare industry. And in fact, that's one of the reasons that we're having this event today, is to bring the two sides together. Healthcare professionals, people involved in life sciences and healthcare work, and blockchain people, blockchain technologists. So let me start off by asking, how many of you are here because you have an interest in the healthcare industry, you have experience, you're working in the healthcare industry or life sciences? Raise, okay. Take a look around, okay. Now, how many of you are here because you are blockchain technologists? Okay, I want you to meet each other. That's the whole point of this event. Healthcare people, life sciences people need to meet the blockchain people. Why? Because, yes, blockchain is going to change the world. Blockchain is going to cure cancer. Blockchain is going to bring world peace. All of these things are true. That's the promise of blockchain. But seriously, we're here because blockchain technology is an opportunity for healthcare problems to be solved, for healthcare issues that are really information-based, technology-based, that are financial issues, insurance issues, regulatory issues. All of these can be addressed using blockchain technology. But there's a problem. The blockchain technology people don't know what the healthcare problems are. And the healthcare people don't know what the blockchain solutions are. So we're here today to bring you together with a series of panels that will help you think about some of these issues that are facing the blockchain industry as well as the healthcare industry, and give you an opportunity to think about how can we make this work? How can we bring healthcare and blockchain together to solve some of the major healthcare problems that we have? Blockchain is not going to cure cancer, but it could help you cure cancer, and that's what we want to do today. The panels that you're going to hear from today cover a wide range of topics. They are unapologetically going to be at a fairly high level. They're going to be blockchain people talking about blockchain technology to other blockchain technology people. There's going to be healthcare issues spoken about in terms of healthcare, sophisticated healthcare concepts. We are not going to apologize for being at this high level. We're doing this. We want you to ask questions. So when you don't understand what's going on a blockchain technology issue, please ask. Same with the healthcare issues. And in that way, we want to have at the highest level, most productive conversation we can have on these issues. A little blockchain 101 for the pure healthcare people who say, wow, I didn't know I was walking into a blockchain conversation. Blockchain 101 is fairly simple. The blockchain technology is a new way of creating a data structure, a new way of storing information that allows us to, with cryptographic security, timestamp and verify that that information has not been changed once it's added to the database. Okay? So it's a new database structure. It's also a consensus mechanism that we use to try to find group truth, that we trust because of the technology and the way that things have been designed, that once information is in, everyone agrees that's the next piece of information in the database, and it won't be changed later on. That gives rise to a whole host of new opportunities for us to use this technology for data storage, but also for transactions. And that's where Bitcoin and cryptocurrencies come in. We're not going to talk a lot about cryptocurrencies, although if you want to talk during some of the breaks, there are plenty of people here who are interested in them. Healthcare and cryptocurrencies are probably fairly far apart. We're really here to talk about blockchain and healthcare. and the ways that we can use blockchain technology to help healthcare move forward. Healthcare 101. I'm not a healthcare person, so, but the places that we're looking for healthcare opportunities in the world of blockchain really go to supply chain management. If we're able to track a pharmaceutical product from its recipients all the way through manufacturing to the shelf to its expiration, you can see how that would be a useful opportunity to put that information on a blockchain and allow all the stakeholders to see it, update it, and use that information fluidly. We see opportunities for drug research and development. If we can work with clinical trials and put that information, that early data on a blockchain, it's there, it's secure, and it's available for others to use. Again, a good way of monetizing data, monetizing that opportunity, and allowing other people to use that data without having to go through a lot of difficult processes to access information. Of course, there's personal health records. Everyone is looking at the blockchain as a way of creating a one unified healthcare record. If all of our personal medical information could be located in one place, so that when we're in an emergency and someone needs to check, well, here's Ted's whole medical history from birth to today. There should be one place to go, securely available, unchangeable, whether it includes all the medical conditions, all the pharmaceuticals, all the procedures, all of the information about a person. Again, a blockchain solution is available. Those are three good examples, but there's plenty more. And again, as part of this conversation, we're hoping you all will think about these and think about different ways that blockchain technology could be applied in the healthcare area. Obviously, one of the things we're going to have to address are standards. We're going to need to have standards across the industry so that participants in healthcare are able to exchange information, to work with each other using the same, in the same language. Language not in the sense of English, but language in the sense of data processing. Are we able to convey information one to the other? And so one of the things that has to happen is there has to be some consensus about how we're going to use this information, how we're going to be able to transfer it across platforms, across systems. Because right now, one of the biggest problems in data processing is, well, my computer doesn't talk to your computer. They use different languages. They use different formats. One of the things we need to think about today is how are we going to make all these systems work together? And another issue we're going to have, of course, is separating the wheat from the chaff. You're going to hear a lot of ideas. People are going to approach you all the time with, well, here's healthcare, here's blockchain, let me put these two things together. Is this going to really make sense? Every time somebody comes to you with a blockchain opportunity, I want you to ask the question, why is this a blockchain? Why does this need to be a blockchain? Why can't I just do this with my ordinary existing supply chain management software, or my Excel spreadsheet, or my centralized database? Blockchain is not the cure-all for everything, and not everything needs to be a blockchain. But it is a good source for new capabilities. So please consider all these ideas with a fair degree of skepticism. Blockchain can be an advanced technology in certain places. In other places, it's just an add-on. So we need to separate the wheat from the chaff when it comes to when a blockchain application really makes sense. And there are people here who can help you with that process, diligencing these things, kicking the tires, so to speak. Will this make sense from a technological perspective? Will it make sense from a healthcare perspective? Will it make sense from a legal perspective? Will it make sense from a regulatory perspective? All of these perspectives need to come together to make a viable solution. So with that, I'd like to introduce you to the first panel today, and we're going to move forward with